is vitamin D insufficiency linked to IgA nephropathy?
So I've unmuted Martin to deal with the COVID question. I think the jury's out on the importance of vitamin D in anything related to kidney disease other than kidney bone disease related to advanced kidney failure. There are lots of studies going on to see whether adding vitamin D helps. But I think I will hand over first to Martin and then to Oonagh to say about adding. Lots of patients like to go to Holland and Barrett's and take multivitamins and extra supplements. So it'd be great for Oonagh to comment on the value of that. But I'm going to let Martin talk about vitamin D and COVID and whether there is actually any connection.
Right. Well, I wish I could answer that question. I don't have the answer to that, and it's something that people are looking at. There are hints that maybe low vitamin D puts you at increased risk of complications associated with COVID, but no definite studies. What we do know is that a large proportion of our population are low on vitamin D, and the ethnic community tends to have lower vitamin D levels. And that may be associated with a number of diseases, and maybe one of the reasons why Black and ethnic minorities seem to suffer more from COVID, but it's speculation at the moment. But it's certainly one of the possibilities is that that's associated with a generally lower vitamin D level. The government advice, I think, is to take vitamin D if you can. So I think there's probably no harm in taking the sort of doses you get in your multivitamins. I know a lot of people do take it, particularly during the winter months. Now the sun's out a bit, well, not today, but out a bit longer, then you tend to get more vitamin D during the summer months because it's a sunshine vitamin. But certainly when the clocks go back, most people do get vitamin D deficient. So I would say there's no harm in taking the small doses. I would check my patients. I don't know if that's a routine that you check them in the renal clinic, and of course you have problems with hyperparathyroidism, so you may be able to talk on that, because that could negate the effects of vitamin D maybe. So in terms of COVID, yeah, probably it's a good idea to keep your levels at a reasonable level.
And I think it's useful. We'll come to Louise as well in children, because I think adults and children are very different. But I just before then, Oonagh, are you happy just to comment on going to Holland and Barrett and stocking up on everything they suggest will make you feel better?
Yeah, I mean, we get a lot of patients that come in, and I completely understand where people are sort of thinking, but people, are really just desperate to take some magic pill or something that will make everything better, and they will go to places, like Holland and Barrett and other such shops, and buy, different, garlic and cod liver oil and vitamins and minerals and all sorts of things, in the hope that it will make things better. And unfortunately, as dietitians, we're very boring, and we just say that, if you follow a general healthy eating diet and aim for a good balance, that probably should be enough. Obviously, if people have got not such a good diet, perhaps they're fussy eating, or perhaps they've got multiple food restrictions, potassium and phosphate, and perhaps maybe other conditions that cause them to have a dietary restriction, then perhaps maybe they need to think about a vitamin and mineral supplement. But I would suggest that you discuss that either with your GP or nephrologist or your dietitian to make sure that what you take is not going to be harmful to your kidneys. And certainly when it gets to sort of the later stages of kidney disease, then we wouldn't recommend that people take any sort of vitamin tablets. I mean, we would suggest that perhaps they speak to the dietitian or doctor about a renal specific vitamin tablet. When the kidney sort of function gets sort of, CKD 4 or 5, then your body can hold on to some of the vitamins and minerals, and that can cause problems. So I would certainly suggest speaking to your renal team about that.
Thanks, Louise.
Yep, so vitamin D, again, in children is a common question that we get asked, and we measure it quite a lot, and often we do find low vitamin D levels and do need to use supplements to replace it. I think there's no harm in the majority of children to taking multivitamins that contain vitamin D, apart from, like Oonagh said, in those where their kidney function is declining, and so it's always good to declare it. I think the important thing to note is that even though vitamin D is linked to lots and lots of different immune conditions and even coronavirus, vitamin D alone is unlikely to be a cure for your kidney disease and unlikely to work to reduce the immune system enough. And so we would often consider it an additional medication or a supplement alongside whatever else your doctor is suggesting. And I think that's important because sometimes people can get very fixed that vitamin D, or even in the news, can fix everything. But I think it's unlikely to be enough for your immune system or for the leaking of the protein to do a significant improvement in your kidney disease. But on balance, we often don't think it does any harm. And I think the important thing is to declare it at your appointment and make sure that your doctors know that you're taking additional medicines so that they can weigh up when that's safe to do and when that might not be safe if your kidney function was beginning to deteriorate.